As we continue to prepare for another surge in COVID-19 cases, which of course we've been hearing from our state health officials recently, they say it's coming our way. We're checking in with area hospitals to see how the ER is doing. And right now we're joined by Dr. David Anthony Buono, who is the Chief of Emergency Medicine at the Hospital of Central Connecticut. Thanks for joining us, Doctor.
You're welcome. Hello.
So our first question, we know that there has been a decline in the number of visits to the emergency room. When did you start seeing that happening?
That started around March, mostly mid-March was the biggest hit. As the COVID cases in the state started to increase, people stopped coming to the EDs, mostly, I believe, out of fear because they thought they would catch COVID in the hospitals. And that wasn't peculiar just to our hospital. That was actually something we saw through the state and actually through the country. But we did see in the last 2 months, we've been rebounding, and we're now back up to about 70 to 75% of our normal volume.
And I think that's some welcoming news, as we recently heard from state health officials that it's not a matter of if we're going to have an increase in cases, but a matter of when.
Yes.
So are there any concerns with the drop in seeing people come in for treatment? I know that's not necessarily something we would think of, but who knows?
The biggest concern is we were worried about people staying home who really had emergency medical conditions that they should have come to the emergency department. And this was, again, a known phenomena that happened. Things that are medical emergencies are medical emergencies, whether there's a pandemic or not. And the biggest ones that we were seeing were people were having heart attacks, symptoms of strokes, and actually ignoring them for a while because they were afraid to come to the hospital. And obviously, those are things that can be time sensitive. And if they're not treated appropriately or quickly, you have an increased incidence of death or permanent disability.
I think we all know someone who has put off some of their medical needs because of everything that's happened. But the ER is a much different situation right now, and you have a lot of precautions that have been lined up. Isn't that true?
Yes, and we start with the staff. The staff goes through a screening process every day before we come to work. Our temperatures are taken. We go through screening questions, and if you have a fever or you fail the screening questions, you're not coming to work. When we do come to work, if you pass everything, we all wear a mask. We have hand sanitizer everywhere, which we've actually had before this. So there's a lot of hand washing, masks, and basically keeping everybody safe.
Right, and that should be reciprocated with those who are visiting as well.
Yes.
Yeah, wear your mask and wash those hands. Thank you so much, Dr. David Anthony, the Chief of Emergency Medicine at the Hospital of Central Connecticut. Be well.
You're welcome. Thank you. You too.